The program we're doing today is provided to you through the Oklahoma Period of Purple Crime program, is from the Oklahoma State Department of Health, and it's paid for with Title V funding. The reason we're doing this program today is that the committee members have experienced either personally or have heard anecdotally about how the program was functioning in different hospitals across the state. And the wide variation that we were hearing about led us to do a survey back in 2014. The State Health Department surveyed nurse leaders and staff nurses, either in person if they were fairly close or over the phone if you were in the far reaches of the state. Helped us identify what we could do to make the program a little more consistent in its message and a little more robust in its presentation. This has led us to the informational webinar. We're wanting to allow you to see how the website is managed, ask questions, and understand how you can implement this program. Joining us today are Alicia Lincoln, who is the Administrative Program Manager for Child and Adolescent Health at the State Health Department, and Lisa Rhodes, who is the Program Manager for the Oklahoma Child Death Review Board. And I'm going to turn it over to Alicia at this point.
Good morning. My name is Alicia Lincoln, and like Barbara said, I work at the State Department of Health. And I just want to give you some background information today about infant death rates in Oklahoma. So when we talk about infant mortality, just to make sure we're all on the same page, we're talking about infants who were born alive but died before their first birthday. And so the infant mortality rate is in the number of infant deaths per 1,000 live births. In Oklahoma, from 2012 to 2014, the rate of infant mortality was 7.5 deaths per 1,000 live births, which averages out to about 400 infant deaths per year. The U.S. rate for that same time period was 5.9 deaths per 1,000 live births. If Oklahoma had the same rate as the U.S., there would have been approximately 82 fewer babies who would have died, which means 82 fewer families and 82 fewer neighborhoods and communities would have been affected. Oh, yes, please. Okay, and so this slide just gives you the 3-year infant mortality rate since 2000. So what we wanted to show is that we are slowly but surely nudging those rates down closer to that U.S. rate, but we still have a lot of work to do.
And good morning, this is Lisa Rhodes, and as Barbara said, I'm Program Manager for the Oklahoma Child Death Review Board. The board reviews child deaths and collects statistical information to help identify death trends as well as system failures and make recommendations for prevention and system improvement. Most of our reports and our data are available on a year of review format, but in 2011 I was able to do a year of death study of 10 years of abuse-related homicides, and of those, in that study it was identified that over 90% of the infant abuse-related homicides were due to abusive head trauma. In 2015, we reviewed 28 total abusive head trauma near death, and a near death is if a child is in serious or critical condition as ruled by a physician as a result of suspected abuse and or neglect. And over 3/4 of those abusive head trauma cases were infants. In 2007, the then Commissioner of Health and the head of MCH, Maternal Child Health within the State Health Department, took note of the high infant mortality rate and reached out to partners and created the Preparing for a Lifetime, It's Everybody's Responsibility initiative, recognizing that there are many things that everyone can do to help ensure Oklahoma's babies are safe and healthy. There are 7 topics that the initiative identified that could potentially help improve infant outcomes. As you can see, premature births, infant safe sleep promotion, tobacco cessation, breastfeeding promotion and support, preconception and interconception care, postpartum depression, and infant injury prevention. The infant injury prevention work group decided to address abusive head trauma and determined that they wanted to see the period of purple crying introduced in all of Oklahoma's birthing hospitals. All of the numbers of abusive head trauma deaths are relatively low, but the injuries are 100% preventable. The program is evidence-based and very low cost. In fact, it is free for the hospital. It is a result of research conducted by the National Center for Shaken Baby Syndrome, and implementation in all hospitals has also been a recommendation that the Child Death Review Board makes in support of the work that, the progress that this program can do.
The National Center on the Shaken Baby Syndrome is the program that has developed the Period of Purple Crying program, and they continue research and advocacy for prevention of abusive head trauma. It's a nonprofit worldwide organization dedicated to the prevention of abusive head trauma. Their awareness programs teach thousands of parents, students, and caregivers, and they focus their efforts in mainly two areas: professional training for those that work with these cases, and prevention and education for parents and those who work to prevent child abuse. This is a map of mainly North America, but a few other countries here that they reach. To explain what the color coding is, the dark purple colors are jurisdiction-wide, meaning every hospital, actually 80% plus hospitals within that jurisdiction are using the program. The ones that are in progress, which is Oklahoma, and a few other ones, is the light purple. And those are states or provinces that have agreed to try to implement this in 80% or more of their hospitals. And then, as you see, the white ones have not undertaken saying that they're going to reach all hospitals, but they are implementing it within certain hospitals within that state, province, or country. This is talking about the Dose 1 program. The Period of Purple Crying comes in 3 doses. Dose 1 is what we do with the primary time that the patient comes in to have a baby. We're catching them at that time while they're in the hospital. Dose 2 is going to be anybody that is then doing physician offices, home health nurses, prenatal education, and so forth. And then Dose 3 is going to be public service announcements and so forth that are done for the community. In Oklahoma, we have 52 birthing hospitals at this time. We have 39 hospitals participating. We have 12 non-participating hospitals, and we have 1 hospital that was participating but is temporarily closed. So at this point, we have 75% of our hospitals participating, and 87% of Oklahoma births are being reached, because most of these are the larger hospitals. As we mentioned before, we did a survey back in 2014. The most common themes that we found in looking at the findings from this were: we had a variance in how the staff was trained within all the hospitals, a wide variance in how the program was implemented within the hospitals. One of the complaints was that they had difficulties maintaining staff training and program fidelity. And they had a big turnover of whoever the administrator was, so therefore the program just kind of dropped whenever that person left the hospital. We're going to ask 3 polling questions here in a moment, and I'm going to ask that you be really honest about this, because one of the things that we found going into the hospitals was that when the nurse administrators answered, they answered one way. When the staff nurses out on the floor that was doing most of the teaching answered, they answered another way. So this is all anonymous, and I want you to actually answer how it is actually done and not so much how it's supposed to be done or how your process is set up. So let's move over. So here are our polling questions. Okay, so let's look at what our answers were for that. And we had, under how were your nurses trained, all on the NCSBS site or the national site, we have a 0. So nobody's doing that consistently with everybody. 4 out of 13, or 31%, said that some of the nurses are trained, some are trained by other staff. Trained consistently by other staff is 38%, or 5 out of 13. And 0% said they don't know, and 4 just didn't answer. So move on to the next polling question. How often does your staff repeat the online training? Okay, so we've got 5 out of 13 say no repeat. 0 out of 13 do yearly, 0 out of 13 do every 2 or 3 years, 7 didn't answer, and 1 isn't sure. Let's look at our next question. Have you accessed the NCSBS administrator site? No one has. No one said yes. 1 said no. 3 said, what's that? We're going to go over that. And 9 of you did not answer. So as you can see, we've got kind of a wide variety going on here. One of the big problems with this is that we're getting inconsistent messaging. If we have other staff training off of somebody else telling them, it's kind of like that old telephone game, you know, where I tell you, you tell the next person, they tell the next person. A lot of information gets lost over time when we do that. We don't have as consistent a message. And like many of the other initiatives that you all are aware of, that having the consistency and a standardized way of doing things really helps improve the outcomes. When we look at the second polling questions about having repeat of staff training, one of the things you might consider is having this in annual competencies, just like you do your fire training or anything else. They just log on, take a little bit of time, and take the quiz and finish up that way. The first aim of the program is to support caregivers in their understanding of early increased infant crying. So again, talking about that crying curve and how that crying is a trigger for abusive head trauma. And I think when I first looked at this, I thought this was a little odd. Second aim was to prevent abuse, and the first aim is to do the training. But the truth is, the only way I'm going to be able to reduce abusive head trauma is by teaching to be patient in the triggers and how we can avoid that. They put out 2 different videos, the period of purple crying and then the crying, soothing, and coping. The period of purple crying video for the family is about a 10-minute video, and then the crying, soothing, and coping is about a 23-minute video. They come in a variety of languages. In Oklahoma, we have both English and Spanish on the DVD. But if you have a high population of French or Taiwanese or some other language, this actually comes in a variety of other languages. I think something like 20-some languages. So if you have a high population of another language, let us know, and we can get that ordered for you in the languages of your choice. when you deliver these education materials to your program, we're asking that it is delivered to all newly born infants' parents by a trained educator or a nurse. It takes about 3 minutes of the nurse's time on average to go over this. I find the best method is to show the video in-house. And I think if you just plug it in and say, here, I'm going to plug this in, I need you to watch it, you get one response. If you say, I'm going to plug in a video about infant crying and the triggers that can cause, and I'm going to be back in about 10 minutes and we're going to discuss this, that kind of makes them put the phone down, not pay attention to the TV, and actually focus on the video at hand because they know you're coming back to talk about it. At that point, you can pull out the little booklet, take about 3 minutes to go over what those key messages are, ask them, what have you learned from this and how would you tell somebody else about it? And it really doesn't take as long that way. I'm going to move on to the NCSBS site. And this is where we're going to spend most of our time, is how this site works, and walk you through it. When you log in to don'tshake.org, this is the home page you come up with. I'm going to just touch on a couple of these other ones. The About Shaken Baby Syndrome or Abusive Head Trauma, that has facts and information. It's got a lot of information about the medical consensus from the medical community. It has information and research available for you to review, and there's a lot of facts, frequently asked questions there. The Period of Purple Crying has an overview of the program. It has the click site. It has program materials for you, and it actually has a back door into this next tab on training. The training tab is where I'm going to go right now. Before I log in, because I'm already a member, before I log in, I'm going to let you know that if you haven't done this yet, you're going to go to this training for implementation. We're not military. We're not foster and adoptive parents, so we're going to go here. Select your organization. At this time, Oklahoma only has 4 or 5 hospitals that are listed, so you can type in the name of your organization. One I remember seeing was Chickasaw Nation happens to be on here. If you type that in, then you can move on. If you're not here, you need to move on to create a new organization. And to not take the time of doing this, you can see you need to put in your organization's name, the information about it. Then you're going to put in your name, your title, your email, and move on from that. Then it will get you where you can come back to. Once you're logged in, you'll be able to do this. So let me get logged in here. And once you get logged in and get your people to this page, this is what they're going to see. I want to point out that there are 3 mandatory lessons here. That is lesson 1, 2, and 4. This is for them to look at. The first one is the Period of Purple Crying video. This is the one you show your parents. The booklet is the one we give our parents. The lines of evidence and rationale for the Period of Purple Crying is actually the professional training that goes on. This is what your nurses need to know. You can get CEUs for this. Then you're going to continue on to your module. We've got the Period of Purple Crying video. You notice mine are all checked off because I've done all of them. When you first open up to this, they are not checked off until you have gone through it. You're going to go through the video, watch that. Once that is complete, you can move on to the next which is the booklet. And you can go through, read the booklet. When that one's through, you can watch the Crime Soothing Coping, which is actually a great video. It's got a lot of really good information, but it does take longer. And then the lines of evidence. This is the professional training that they need to be doing. We're not going to go through the whole thing, but this is where they get into all the information that professionals need to know. Once they have gone through all 3 of the mandatory trainings, then they can come in and take the quiz. Once this quiz is completed, they'll get a score. Other things within this site, before I get into how you can do the administration part, other things on this site that I think are informational for you. I sent out an email to most of you that were signed up a little earlier, the implementation checklist. It goes through and tells you how to do the registration, how to do the training. You can do group training, you can do individual training, and it walks you through that. You can do the 3-minute talking points. It's just little bullet points that go along with the booklet, or you can just go through the booklet and highlight the key points. I sent you an example of a policy. I realize it's a little in-depth, but it does have some good information in here. Just like anything else we do, we need to have a policy, and the policy needs to state why we're doing the training, who we're doing it for, who is doing the training, the process that we're going to go through to do that, how they are educated, and then how it's going to be documented. And again, I agree this one's a little detailed, but it's helpful. There's a lot of other information in here. If you want to go through and look at, it's really kind of a fun site to go through and get a lot of information. But I think the thing that I want to go over with you now is up at the top of the page. Once you have logged in, it's usually either the manager, the educator for the unit, or somebody that you have assigned. I would strongly suggest that you assign 2 administrators. What we're hearing too often is the educator was the person that was supposed to be in charge of all the training. They walked away, took a new job, and now nobody has a clue how this works. So if you go into the administration panel at the top, this just happens to be the one that I have kind of set up a dummy organization here through the Office of Perinatal Quality Improvement. You can see all the people that you have invited. And the way this is going to work is you can go in and invite new users. I personally think the easiest thing, if you're going to do this, say you hire 5 new people, or you're going to say in October, I'm going to make everybody on the staff start doing this, and so I'm going to send out an email to everybody. Once you have identified your organization and you have set it up, like we did on those previous pages, then you're going to go in, send an email to all of your people, and you're going to copy and paste this site into the email, and it will open them up to that front page, and then all they have to do is sign in their own name so that it will come up under that. So that's how you can invite people. Going back to the users, I can see when those people came in and created an account, so when they actually logged in. And my guess is what you all are really wanting to know at this point is, how do I find out if my people, once I sent them all that, did they do the training? So you're going to come in under Reports, I'm going to look at, I can do all lessons if I want to, but if the thing I'm really wanting to find out about is, did they do the quiz, I'm going to go in under Download CSV. That gives me, I can get a main report and I can actually look at everything they did. But I know that they can't have done this quiz if they didn't already go through and look at the other 3 items. So I can click on Quiz. It will give me a printout of who passed their quiz and who didn't. Have they done it? Have they passed it? Have they not started it? And that gives me a list of who did it. I think that's the easiest way to go through here. I think that's the, where's our, so with that being said, I'm going to let Alicia talk to you about doing the program within your own hospital, what your staff should be doing.
Okay, thanks, Barbara. So the protocol for Purple is really kind of neatly summed up in the 3 words on this slide: the watch, teach, and give. We want our new parents to watch the DVD while they're in the hospital. The research on the program tells us that watching it while they're in the hospital and having those points reinforced is a way that they're going to remember those key messages once they take baby home. So however your facility implements this, via watching it in the DVD player, over the closed-circuit TV, please, we want them to watch that 10-minute video while they're there. And then come back into the room and deliver those teaching points. Go through that booklet with them, and then do the teach-back exercise where you're asking them, just to make sure I clearly explained it, can you tell me how you would explain it to your babysitter or to grandma and grandpa? Because we want to make sure that the parents are understanding what those main messages are. And then we're giving the parents the video and the booklet to take home and asking them to share it with the other caregivers. Whoever is going to be watching that baby also needs to have exposure to the information in the Purple video because they need to understand the peaks in crying. They need to understand what they can do if they become overwhelmed, because it's not just moms and dads who become overwhelmed when a baby is crying. It can happen to anyone who's giving care to the baby. So now we're going to watch a snippet of a video that'll kind of demonstrate this principle in the hospital setting.
Actually, I have some really important information for you, Stephen. Congratulations. And what I want to talk about is a program called the Period of Purple Crying. Purple crying is a way that we're thinking about newborn crying. The word purple stands for the things that are going to possibly frustrate you the most about Noah's crying in the next few months. The first P is for the peak amount of crying. He's going to start out at about 2 weeks, and then he's going to increase his crying over time up to about 2 months, and then it's going to decrease. The U is that it's unexpected. The crying can come and go for no apparent reason, no matter what's going on throughout the day, that he might just start crying for no reason. The R is that it can resist soothing. Even though we want you to hold him and comfort him, sometimes no matter what you do, it's not going to help, although providing soothing can help for up to decrease the crying up to 50%. The second P is that it might look like he's in pain even when he's not. So he might have his face all scrunched up and look like he's in pain. The L is that it can be long-lasting. Some babies increase their crying 20 or 30 minutes more a day, and some babies increase their crying 4 or 5 hours a day. So he can have an increase in crying And the E is that it can happen a lot of times in the evening. So when you're cooking dinner, when Stephen's coming home from work, when you're trying to get things done in the evening is when babies tend to increase their crying the most.
Okay.
So that can be kind of frustrating for you. And what I want you to make sure and know is that all babies increase their crying. It's nothing that you're doing wrong, nothing that Stephen's doing wrong. It's not that you have a bad baby. All babies are going to increase their crying. One of the most important things to know is that during that frustration,
that is just an example of how the training can be done. That was actually the nurse the way she did it, and they liked it, put it on their site, and you can pull that off of their site under the training and show it to your nurses if you would like. When we talk about sustainability and fidelity of the program, we talked a little bit about needing a policy. Kind of reminds me of a lot of the other things that we do, and to me, breastfeeding comes to mind. In the past, before we started having such good breastfeeding education programs, we were giving out a lot of information. It was whatever we learned from our preceptor, whatever we experienced in our own roles as mothers. And sometimes the information was a little confusing to the parents. Sometimes they got good information, sometimes they didn't. Sometimes they would hear from one person and the next person would come in and ask a question. And because they hadn't received the same training, they would get different answers. So I think that's why it's important that we have a policy to make sure that we have continuity going on. How are we going to initially train the staff? Whether it's starting staff over as new with the program, whether that is new incoming staff. How are we going to do ongoing staff education with refreshes or updates? Who are we going to assign as our program administrators? And again, I think it's very important that we have more than one. The steps to assessing online training, how you're going to order more materials. And at this point in Oklahoma, we're sending out twice a year, usually in June and again around the first of the year, DVDs out to each hospital based on what their number of births the previous year were. So if you had 2,000 births in 2014, then you should have got 1,000 DVDs around the first of the year and another 1,000 in June. Documentation of the patient education. How is that being documented along with your other discharge teaching? Do you have a sheet for that within your EMR? Is it still a paper sheet? How are you doing that? And does it just say period of purple crying training, or does it say watch DVD nurse instruction? So I think those are some things that are important to remember. At this point, we're going to open up for questions, discussion. We're going to unmute the phones, see if anybody has anything to say. Either how the program is working for you, problems you've had, questions you have about how we can do things differently, or how you might access the training or the administration pages.
Barbara, this is Joni and Enid.
Yes, Joni.
So since we're part of Integris on that organization, is it just Integris or is it each individual institution, each individual facility?
It's going to be each individual facility.
Okay. Thank you.
So when you set up your hospital within there, it will be Integris, whichever Integris you're with.
Okay. Thank you.
Does anybody else have any questions or comments? How is the program working for you? Truthfully, one of the reasons we brought this up is, as I said, we're getting a lot of anecdotal stories from committee members, nurses we know. They went in to have a baby, their daughter went in to have a baby, their cousin, their niece, whatever. And we're hearing a whole lot of, it was never mentioned to them. Even though I know most of the hospitals have this in place, it was never mentioned to them. They might have got home and found a DVD in their packet of things and had no idea what it was. And so that's what we're trying to kind of get past, is just sticking the DVD in and saying, oh, here's an extra little something for you you can look at when you get home. It's a discussion that needs to take place within the hospital. And again, it's a 3-minute discussion before they go home. Okay, well, if there is no other comments or questions at this point, we're going to move on to CLICK.
Yeah, CLICK is a supplemental activity as a part of peer-to-purple crime that is meant to serve as a concrete visual reminder of purple. There are handmade purple caps that are collected by the work group throughout the year to be provided to the babies that are born in November and December. And that could also be a way to initiate the discussion and the education portion of it, is when you go into the room or however you have the hats set out. Sometimes some hospitals make trees for the family to come out and pick which hat that they want. That can be a nice icebreaker to begin the education program. It is a way to bring in more community partners and engage people with the message of purple who might not otherwise be exposed to crying babies and the risks involved with it. You get a lot of your some families, women who don't have families yet but want to be a part of a prevention program, as well as some of your more mature members of the community who are past childbearing age but want to also contribute to the prevention as well. And it's just another way to engage people with the message of purple, that babies are going to cry and there are sometimes going to be nothing that we can do about it, and that when you sense yourself getting frustrated and need to take a break, that is okay to do so. So that is just one of the fun aspects of it, and I don't know if anyone has any feedback on how that has gone as well, but we do have a wonderful time tagging all the hats that come in every year, and it's just another positive spin on something that could be potentially negative.
So you should be getting your caps the first part of November, the end of October, to be passing out in November and December. Do we have any other comments or questions? Okay, well, we want to thank you all very much for coming today. And if you have any questions, if you're having any issues with the site, if you're having any issues with getting your DVDs, anything that you need, please contact me. This is Barbara at the Office of Perinatal Quality Improvement, and we'll take care of whatever's going on for you.